Today we are talking about Plan B, what it does, is it going to work, what your bleeding is, and just everything that you might have questioned, or if you run into one of these scenarios later on. Hi, my name is Andrea. I'm creator of Care to Tango, a women's health practitioner. We're going to talk all about your periods, your fertility, and your health. I posted a recent TikTok about Plan B and the basics, how it worked, and I was flooded with comments and questions, and I didn't really realize how much attention this topic actually needed and what little information there was out there. So I too have been there. It's a stressful situation, especially given the recent access to certain things. It is a taboo topic, and a lot of people don't feel comfortable asking for guidance or help on this topic. I want to provide you with all the information I have to the best of my knowledge. Studies are still ongoing, information changes, and bodies are different, not medical advice. If you have any medical questions, please talk to your practitioner, or if you have any emergency situations, please go to your urgent care. We're gonna start off with what it is, and Plan B is a form of emergency contraceptive. And when we refer to Plan B, a lot of people just use Plan B as all emergency contraceptives, but there's actually 3 different forms. One is the Plan B, which is like your classic pill you'll find at the pharmacy. It is 1.5 milligrams of levonorgestrel, which is a synthetic form of progestin that is similarly found in like some birth control pills, just at a higher dose. Number 2 is your copper IUD. This can be inserted up to 5 days after unprotected intercourse. The third option is a pill called Ella, which uses ulipristal acetate, which is different from the Plan B pill. So Plan B is just a brand. A lot of other brands that's similar to Plan B, like Next Step and My Way and all those other pills. So a lot of times what it is just the 1.5 milligrams of that levonorgestrel synthetic progestin. So these pills are time sensitive. You have to take them within 72 hours and maximum 120 hours. So that's 3 days or 5 days, but we're gonna aim for the 3 days and prior. So the closer you take it to the incident, the better it's going to work. First, we're gonna briefly discuss the menstrual cycle so you guys have a better idea of what is happening during your cycle and how these pills are actually going to work. And when I refer to Plan B throughout this video, I'm referring to the synthetic progestin emergency contraceptives, but we're just gonna call them Plan B for easy sake. So the first day of your menstrual cycle is day 1 of your full bleed period. It is not a spotting, it's your full bleed. This is also day 1 of your follicular phase. So your follicular phase is from your day 1 period up until ovulation. So the first day of your period, your hormones are very low. Estrogen, progesterone, and testosterone are all very low. And throughout that cycle leading up to ovulation, they're going to rise. Estrogen is going to rise. Progestin, we're going to leave to the second half of the cycle. So that stays relatively low. Your body is working to develop these follicles and eggs that are in your ovaries. Your brain releases something called FSH, so follicle stimulating hormone. And remember that for later because this is partly how the Plan B pill works. So your brain's gonna release that hormone, which develops these follicles, which house your egg. These follicles also release estrogen, and this increasing amount of estrogen is going to develop your uterine lining. So when you get your period at the end of your cycle, it's developing that lining, and it's also going to cause your cervix to produce this cervical quality mucus. So during that fertile window, when you start to get more moist and it develops to maybe a stretchy, clear, or lubricative sensation, that is caused by your estrogen and can give us a clue that we're leading up to ovulation. So as your brain releases this FSH, eventually one dominant follicle is going to be chosen for ovulation. So this growing follicle has that increase of estrogen, and once we get that swift rise, your brain is going to release something called LH, or luteinizing hormone. And this causes that follicle to rupture and release that egg called ovulation around 24 to 36 hours after that spike. So ovulation has occurred, we release that egg and is in the fallopian tube. So this is entering our second half of our cycle called the luteal phase, which is from ovulation up until your next period. Something else LH does besides releasing that egg is also transforming that empty follicle now into something called the corpus luteum. And this is going to pulse progesterone and make progesterone for the remainder of that luteal phase. And this is where your primary amount of progesterone is coming from. So if you're not ovulating throughout your cycle, you're not really making any progesterone. And it has a lot of good health benefits. Another thing this corpus luteum does is nourish and stabilize your uterine lining. And this corpus luteum tends to last about like 12 to to 14 days. And this is why once you ovulate and you've confirmed ovulation, you'll pretty well know when you get your period as long as you're not pregnant. If the egg is not fertilized, this corpus luteum is going to break down again, and then you're going to get your period. If it is fertilized, then it's going to continue to make progesterone until the placenta can take over. So now that we know how our cycle works, let's discuss how the Plan B pill is going to work. So simply, it is meant to postpone ovulation. So therefore, no egg is released, it can't meet a sperm, and then you won't get pregnant. As we talked about prior, estrogen dominates that first follicular phase and progesterone dominates that second luteal phase. So by taking that synthetic progesterone in the first half of your cycle, it is going to suppress FSH from your brain, therefore stopping the development and maturation of that follicle. It also inhibits the LH surge, therefore stopping ovulation. Sperm can only live up to 5 days in that cervical quality mucus or your fertile window. By halting ovulation, it is proposed that it gives enough time for the sperm to die before ovulating, thus preventing pregnancy. So that is the main mechanism of Plan B. It is going to push ovulation before that LH spike occurs. Many studies have shown that the closer you take it to ovulation, the less likely it is going to work. So if that LH has already spiked and you're already in that 24 to 36 hour window leading up to ovulation, it's not going to work to prevent ovulation. And also, if you've already ovulated and that egg is in your fallopian tube, it is not going to prevent in that way as well. So another thing that progestin-based like birth control pills and stuff do is to thicken that cervical quality mucus so the sperm has a harder time getting through. And with birth controls, this is one of the main mechanisms that help it to work. But studies haven't shown that taking the Plan B pill that one time has any effect on the cervical mucus quality. So for now, the main mechanism is pushing ovulation so you don't ovulate. And again, studies are still ongoing. We may see different methods of action more clearly in future studies. It's also very important to note that Plan B and any other emergency contraceptive is not an abortion pill and will not work in that way. So that brings us to the question, is it worth taking if you think you're about to ovulate? So this is a tricky question because some studies have shown that it isn't really helpful in pushing ovulation if you take it right before or right at that LH surge or right before that ovulation day. But again, were these studies, were they taking a strong enough dose? It's also hard to know exactly when you ovulate, especially if you're not tracking your cycle or if you have an irregular cycle under physical or mental stress. So taking it might be worth it regardless of where you think you are in your cycle. If you're looking for something with a higher chance of preventing pregnancy, if you think you're in that window, you might opt for the Ella pill or you might opt to get a copper IUD. So the Plan B pill doesn't require a prescription or a consultation from your doctor like the Ella or copper IUD does. And you should be able to find them at your local drugstore. And this is why they're more popular because generally they're more accessible. Just ask the pharmacist for a morning after pill, or you can find them on these shelves. A lot of times they're in like the feminine hygiene section, and the cost is about $10 to $50 depending on your source. I know it can be nerve-wracking to ask for these pills, but believe me, there is a ton of people going in for this. And in my experience, the people who are working there are always happy to help. They're not judgy and also pretty discreet. If it's easier for you, you can get these ahead of time and just keep them in your cupboard. Usually there's an expiry date of about 3 to 4 years, so you can keep it for a while. If you don't want to go into a store, you can also find these online, like Amazon has them, but I'd be careful about getting them from Amazon. Just make sure you're getting it from a reputable supplier. Or there's a ton of other websites you can get them from. I will post it in the caption below. So as I said earlier, weight actually matters with these pills. The efficacy of the Plan B may differ for those weighing more than 165 pounds or have a BMI of 25 to 30. There's no clear weight or BMI, and this is because you could have a higher BMI with higher muscle mass and someone with a higher BMI due to adipose tissue. So this is due to the blood concentration of levonorgestrel seen in the blood, and the Plan B hormone can get stuck in the fat cells, preventing them from getting into the bloodstream, therefore not work as well. It's better than nothing, and in this case, you might want to double up on dosing, which is still shown to be safe. Theoretically, should increase the amount that reaches the bloodstream, but this is still being researched. So how will you know the Plan B pill actually worked? This is probably what you've been waiting for and what you want to know the most. Did my Plan B pill actually work? And the Plan B pill can cause a lot of cycle disruption and delay in your period, which can freak you out. And again, how well it worked will depend on when you took it, where you took it in your cycle, and along with your own body chemistry. So you will only really know that it actually worked in retrospect when you get your true period. mostly moderate to heavy bleeding, or what your normal period would be like. Or take a pregnancy test about 2 weeks afterwards. Usually 2 to 3 weeks after you've had intercourse, you should test positive for pregnancy if you are. If you took it in the follicular phase, so again that day 1 up until ovulation, getting something called a withdrawal bleed around 4 to 7 days after you took that pill is very, very common. This is another indicator that it could work, although it's not 100% reliable. This withdrawal bleed comes because of the pill. So remember how we talked about the progesterone in the second half of your cycle, which holds in your lining? When that progesterone drops off, that causes your period. So if you're in that first half of your cycle and your progesterone is really low and you take a pill of synthetic progestin, and once that gets out of your body, you might get something called a withdrawal bleed. And it's a very similar bleed to if you've ever been on the birth control pill, or you know about the birth control pill. During that sugar pill week, you get a bleed. It's because you stopped taking the hormone pills, which caused that kind of release of your uterine lining. So this withdrawal bleed tends to last a few days to a week. It seems to be about a moderate bleed. You might have some clots in there and can feel like a true period as well. Now, this withdrawal bleed only tends to occur if you took it before ovulation, because if you have already ovulated and your body is naturally making that progesterone, that is holding in your uterine lining. So if you take the pill during that point, a lot of people don't get a bleed because the progesterone is still holding in that lining. So whether the hormone from the pill drops off or not, you might not bleed. It's possible to get maybe a little bit of spotting or a slightly early period, but usually there's no bleeding until you get your period. So if you get a withdrawal bleed, it can be a good indicator that the pill did work to halt ovulation. You haven't ovulated yet, and you're getting that bleed from the pill. Now remember, if it indeed pushed ovulation, you will start to work back up to ovulation, most of the time occurring after withdrawal bleed, but it can occur during that withdrawal, so just be wary of that and still take precautions. And this can differ per person, some ovulating earlier than others, so keep an eye out for that cervical quality mucus that is stretchy, lubricative, clear, abundant, or watery. That can give you an indicator that you are approaching ovulation again. And then once you've ovulated, your period should arrive in about 12 to 14 days on average. If you're tracking your cycle on an app, likely it's going to be later than what your app is telling you. So many of you will say, why am I spotting after taking the Plan B pill? And if it was taken during that follicular phase again, you may experience that withdrawal bleed. If you're spotting multiple times after Plan B, spotting can also occur just again before your true period, as your body may be working back up to ovulation, but not quite get there yet. And this can result in either a drop in estrogen, which sometimes causes spotting, or a constant low estrogen resulting in a very full uterine lining, and sometimes breakthrough bleeding can occur. And this is commonly brown, but can be seen as red as well. Spotting sometimes can also be ovulation spotting. So it could be you ovulating, and then your period should come about 12 to 14 days after that point. Many of you worry about implantation bleeding after you take the Plan B. This implantation bleeding is caused by the embryo burrowing into your uterus, which does give you a sign that you could be pregnant. So how do you know what is implantation bleeding and what is withdrawal bleeding? Well, implantation bleeding tends to occur around 5 to 10 days after ovulation. Once that embryo gets to the uterine lining, then you might get a little bit of bleeding, but this tends to be way lighter. It tends to be just enough for maybe like a panty liner, maybe not even anything. It can be bright red, pink, brown, and only lasts for like a day or two. So the withdrawal bleed tends to be heavier, longer, and tends to occur around that 3 to 7 day mark after Plan B. So when should you expect your true period after taking Plan B? This depends on when you took the pill as well as your body. If you took it in your follicular phase before ovulation, you may see a delay in your cycle. So once you ovulated, you should see that period in about 12 to 14 days, 16 days max. And you may see a shortened luteal phase resulting in an earlier period after you ovulated as well. You may have a lighter or heavier period once you get your true period, and you may experiencing spotting on either end of your period. If you don't get any form of bleeding 2 weeks after you take that pill, I would take a pregnancy test just in case. And if you still have no bleeding by that 3 week mark, I would take another one. If you took the Plan B pill during your period, you might see your period get lighter or stop altogether and then resume once that progesterone is out of your system. And this can lengthen the time that you are on your period or cause another bleed to come immediately after. So when I took Plan B for the first time, I remember I felt pretty good. I had no side effects and my period came on time. The second time I took it, I felt very nauseous. I had spotting about 6 days after for 4 days. That was kind of a brownie color. I also experienced a big delay in my ovulation and thus my period. That's not gonna be the case for everybody. My cycle is just very, very sensitive, and that could have been related to other stressors or a combination of them both. And the point is that the experience may change each time that you take the pill. So common symptoms are nausea, vomiting, cramps, fatigue, dizziness, headaches, breast tenderness, diarrhea, menstrual changes, or spotting. And these can pop up a few hours after taking the pill and last about 24 hours or longer. It is very, very common to have like PMS-like symptoms a couple weeks after taking them, or have worse PMS leading up to your period. If at any point you have severe symptoms like severe cramps, flooding, which is like heavy, prolonged bleeding, missing periods for more than a couple months with a negative test, bleeding or bad cramping with a positive test, or any other concern or allergic reaction symptom from the Plan B pill, please seek medical attention. There are a few drug interactions with the Plan B pill, so just talk to your pharmacist or doctors if you think this might concern you. I have a list of them on my blog as well. So are there any long-term side effects from taking the Plan B pill? The short answer is no. For once in a while use as they're intended is likely okay and won't harm fertility long term. No study has ever shown a direct link to infertility. We're gonna answer some common questions about Plan B. Yes, you may take Plan B levonorgestrel while on the hormone birth control pill, the patch, or the IUD. If you are taking your birth control pill correctly, it should be enough to prevent pregnancy at a higher effectiveness than the Plan B, but if you are using it as a backup due to some incident, you may continue to take your birth control as normal. You may experience some spotting or brown bleeding during this time until you end that pack. This can be normal due to the variation of hormone amounts of Plan B compared to your birth control, and some people even see a delay in their period once they stop that pack for the month and they're on their sugar pills. If you happen to use the Ella pill instead of the Plan B pill, this does not use synthetic progestin. It uses the ulipristal acetate, so you must wait 5 days to continue the use of your birth control pills because it may affect how this emergency contraceptive works. Can you take Plan B if you are pregnant? Please do not take Plan B if you know you are pregnant. It is not an abortion pill. If you took it and got pregnant, Plan B and other brands, there's no harm to the fetus or any long-term birth effects. Talk to your doctor with any concerns. The risk of ectopic pregnancy seems to increase with emergency contraceptive use during that cycle if the contraceptive fails. So if you experience a bad cramping on one side along with heavy bleeding or bleeding, please talk to your doctor about that possible risk. So will Plan B affect pregnancy and future fertility? Again, there aren't any direct long-term effects noted. However, if you're popping them like candy, it will affect your hormone regulation short-term due to that hormone imbalance. How many times can you take the Plan B pill? There is no limit. You can take more than once per cycle if you find yourself in that position. There is no cap on the number of times you can take it. But again, I would try to avoid relying on it if it's happening more than once in a while. It isn't because it'll make you infertile long term, but due to the progestin disrupting your cycle and causing hormonal irregularities. It's expensive, it can make you feel crappy, and it's no fun dealing with an irregular cycle. If you are taking them often, I'd look into another birth control method or the fertility awareness method. So will Plan B cause a hormonal imbalance? This will look different for everybody. Yes, it will disrupt your hormones and balance as you're introducing a synthetic form of progestin into your body. This is why you can experience symptoms. Most cycles return to normal in the next months or within a few cycles. You may experience changes to your periods, heavier, lighter, spotting, brown bleeding, sore breasts or nipples, or more intense PMS symptoms. To get things back on track faster, focus on eating healthy, eating enough calories, getting enough sleep and sunshine, moving your body, reducing stress, and doing the things you enjoy. Here are some symptoms of a possible pregnancy. Again, everyone is different, but some signs could be the implantation menstruation bleeding that happens around that 5 to 10 day mark post ovulation, and you may have symptoms like irritability, fatigue, crampiness. You might notice discharge changes or bowel changes. A really common symptom is swollen breasts or sore nipples, but don't worry too much as these can be PMS symptoms as well. Again, if you are uncertain, take that pregnancy test at that 2-week mark or 3-week mark. So if you are in fact pregnant, that positive test should show up. This is because your body will start producing that HCG that can give you that positive pregnancy test. A blood test is more sensitive to confirm a pregnancy. Urine can be used around that 10-day mark, depending on how sensitive the test is. If you test too early, that HCG might not show up yet on the test and show a false negative. So if you are suspicious of a pregnancy, just test at a later date. Can I have sex after taking the Plan B pill? You can have intercourse after taking the Plan B. Use an alternative protection, and if you have another slip up, another dose would technically be required. There are many reasons to take Plan B or emergency contraceptives. It can be anxiety inducing and confusing. I hope that kind of cleared up a few things on what to expect and provides you some comfort. Remember, these are ongoing studies that revolve around the efficacy and mechanisms of the emergency contraceptive pill. And I know this topic and similar ones can be taboo or uncomfortable to talk about. If you want more information, follow me on TikTok and check out my blog, caretotango.com. I have a full blog post on the whole ultimate guide of Plan B with more information and detail. If you found this video helpful, please like and subscribe, as I'll be bringing more tea to the table about your hormones, fertility, and health.